Welcome to the part 4 on insulin and diabetes. In this part, we will be looking at the experience with the clinically supported lifestyle correction. In the earlier parts, we had dealt with the causes, diagnostics, and the general nature of insulin and diabetes. In the second part, we have dealt with the latest in medical treatments. And in the third part, we have looked at the comorbidities and complications associated with diabetes and insulin. The first question in part 4, that is experiences in clinically supported lifestyle correction, is what is the difference between lifestyle correction on one's own and clinically supported lifestyle correction?
See, for the lifestyle correction, self-lifestyle correction is when the person is getting some understanding about what is a correct lifestyle and trying to do that. But that is the ideal way of doing. If it is only minor problem, if you are pre-diabetic and if you are finding that you are overweight or slightly obese, then you may be able to reduce your weight by self-controlling your diet and doing some exercise. That is a successful lifestyle correction itself. But if you are not able to get the expected result, or you are taking any medications, you are already on medications like insulin and anti-diabetic medicine or heart disease, you have already put some stent or bypass surgery and on cardiac medication, then you won't be able to do the lifestyle correction by self. Those who are on medication, it will be very difficult, because especially the diabetic medicine, because it will be, if you are not able, if you will not be simply, you will not be able to control your food. If you strictly control your food, you will get a hypoglycemia. So only with in the clinically supported lifestyle correction, what is doing? The other one, you are doing itself. Here, with the clinical monitoring, if you are on diabetic medication or any other medications, we are in the clinically supported lifestyle correction, we get an overall picture about your body by doing detailed examination of your heart, blood vessels, immune system, hormone status, nutritional status, and even how much fat is there in the body, what is your body age, the actual body age, and the people may be only 45 years, but the body age may be 75. We have seen like that. And the blood, now we have the method to assess the blood vessel aging. If the blood vessels also deposited with the fat and the blood coronary artery block and all, those patients may be having the vascular aging will be high. There are methods to find out that also. There are simple methods without side effect. This ultrasound scanning, CIMT, the carotid artery intima media thickness. So such tests are available, and you can check that and see what is the current situation of the body and your organs. And then we are starting with that. And that also the special low calorie food with there is the essential nutrition and nutrients and vitamins and minerals and all the. We are the clinical support. What you are ensuring all the nutrients in a very low calorie diet, preferably if the patient is obese. There is a reduction in the fat also is needed. So fat has to be burned out. You cannot remove, just take away the fat or dissolve it just like that. So it has to be used by your own body. For that, we had to increase the blood circulation also. We can and this calorie use has to be increased. The metabolism has to be increased. For that, the special sort of exercises should be there. Ideally, for a patient, they should have all the 57 nutrients, including the oxygen and the water. And also, you have to exercise all the 650 muscles. There are around 650 muscles and the 230 bones in your body, and the 230 joints are there. All the joints and all the muscles has to be exercised. Why? When you are doing the exercise, certain hormones are coming out, and it has an influence on the pancreas also. For example, osteoclast, one of the hormone which is come out of the bone while you are doing exercise, or some sort of myokines, then have an impact on your brain, which is controlling your appetite, and also in the pancreas. It will actually increase the islet cell multiplication, or the pair or the multiplication of the islet cells also is there. So in ideal exercise, all these muscles and joints has to be activated. Most of these patients are sick. They cannot do the running, or even the running will give only exercise for your leg muscles mainly. But what you need is all the muscles has to be activated in a systematic way. And you should ensure that all the vitamins and minerals and even the oxygen is taken. There are enough oxygen in the air, but if you have to take if your body has to get it, it is not only the deep breathing is needed, and also the blood has to, circulation of the blood has to be increased. That also you can activate only through the skeletal muscles. So when the muscles is activated, the circulation also, and the whole body system, even the organs, liver, kidney, everything will be activated with your exercise. And the only thing human can do with your own will is the skeletal muscles actually. So that is the exercise. That if you are doing in a systematic way, that will give you a result. That is actually done. And also another thing, that is one, nutrition, optimal exercise, and then third is reducing the toxin. Reducing the toxin from the food additives. So that is a strain for the body. And also all the medicines you are taking is a toxin for the body. All the diabetic medicine, all the hypertension medicine, all the medication you are using for the heart or whatever diseases, it's all toxins. And also it is all suppressing, or some or other way it is influencing your immune system. It is actually blocking your immune system. These diseases are inflammatory diseases. So anti-inflammatory, this painkillers is anti-inflammatory, anti-asthmatic medicine is anti-inflammatory, anti-allergic medicine is anti-inflammatory. Cancer medicines is, everything is harming your immune system. In the clinically supported lifestyle correction, what is done is you are encouraging your own immune system to help to heal yourself. So to give nutrition and get the healthy cells, the immune system cells to become healthy. Actually, that is the reason very fast result also. The immune system cells is almost 90% of the immune system cells is replaced within a week. So you can, in the clinically supported lifestyle correction, you can see the result evidently within a week itself. That is the most encouraging thing for the physician and also for the patient.
See, in the case of diabetes, treatment in clinically supported lifestyle correction way, what is the support that patient requires from his family or his caregivers, so that it can be done successfully? Because a lot depends on that also, I think.
See, what I am saying is, the problem is the system, the medical system or the healthcare system is stabilized in a certain way. In the type 2 diabetes, medications, tablets, and all that, lifestyle diseases, it's even in every system, or every NIH or the major hospitals like Mayo's Clinic or the Harvard Medical School, everywhere, the first line of management of the lifestyle disease is the lifestyle correction, food and exercise. But when one person is saying that one patient is understanding about the real clinically supported lifestyle correction and they are planning for it, when they ask their physician, they will just oppose it. They say that it's a pseudoscience. That is the problem actually now we are facing. Anything natural is pseudoscience. That is actually came to in the, it is actually just around 50 to 75 years, gradually this, with the modern medicine development with these medicines, it is actually gradually developed. And that system is very strong here. So even every doctors, we see so many, all the doctors also, modern medicine doctors also taking this modern medicine, this insulin and diabetic medicine, they also really believe that. And that is the way, because they are using these things for the last 50 or 60, or even the young generation doctors are taught in that way. So thinking in a different way, it is very difficult. So that is that mindset of the people, and also the doctors also has to change. And they should understand that this hyperglycemia, that is simple, it is very logic. Anyone who has common sense can understand that already it's a lifestyle disease. It's not because of the lack of insulin. Yes, if it is type 1 diabetes, lack of insulin replacement is needed. But type 2 diabetes, no insulin deficiency, it is insulinemia. Hyperglycemia, insulinemia can create fatty liver. Even Alzheimer's disease, hyperinsulinemia is one of the factors which is creating this memory problems and all the system, because it is actually affecting the blood vessels, the hyperglycemia and the high insulin, high sugar, glucose. It is damaging your blood vessels. So that is simple logic we should think, and the people, even medical fraternity and also the common people, has to change. That is the only way out from these lifestyle diseases, especially the diabetes, which is affected by so many of the people. And someone is trying to correct their lifestyle. This family members and the doctors, their friends, if there are so many family members or doctors or friends are there, they cannot do it because they will discourage with all their might. That is what I am seeing.
Regarding this, you mentioned this diabetes actually will affect the blood vessels and including the blood vessels in the brain and all that. So how far is it that that diabetic patients generally their mental status may not be as good as when they were otherwise healthy, and we generally hear that because of that the patients are not able to actually get the best treatment. So you also mentioned that stopping medication and stopping insulin and all are very fundamental to improving the health of the person and getting reversal of diabetes. So how does all these go together?
See, now the problem is what we are believing, that it is unscientific things we are thinking that scientific, and the scientific thing we are taking as pseudoscience. So that the understanding of the people has to become more scientific, and they should understand it, and don't just because the medical curriculum is also in that way. It is all westernized. In Indian, this thing also, now the government in the Indian system, the Ayush and this naturopathy and yoga and all is coming up. I think it is a very big boost for the real corrective measures to come in the health field. So basically, we should understand the life sciences, not the medical science, which is helping us. The medical science definitely has a very important role, especially for the accidents and vaccines and antibiotics and all. Actually, some wonderful things. But for the lifestyle diseases, we have to understand the lifestyle is the problem. So one should know how to correct the lifestyle. And even the food habits has changed a lot. And the living style, because now previously we are doing so much of physical activity. Now there is no physical activity, and in the next 10 years it will be again reducing with the droids and the things. It will be again, the physical activity of the human will be again reduced. So we had to change our lifestyle also accordingly. The food habits and the exercise also. Your body is designed for doing some physical activity, and also to eat according to your physical activity. So if you are eating more and doing less physical activity, that is the reason for this lifestyle disease. And another thing is this toxin exposure. You using all the pesticides, weedicides, all the residues are coming into you, and even the medicines you are eating. We all think that this pharmaceutical pollution is a big thing. This is pharmacies are producing the pharmaceutical pollution. It is not. Each patient is a part of the pharmaceutical pollution. If has studies done in many of the rivers in all over the world actually, and in India it is the Yamuna water for studying. It's so much polluted, and the pharmaceutical pollution is the metformin is the maximum level. And the next is, that is the first line of management in the diabetes. Metformin is very high in our rivers. And next I think is caffeine. That is because of this all the soft drinks and the coffee and all we are eating. And next is actually carbamazepine, one of the anti-epileptic and medicine and also psychotic medicine. Psychiatric problems also this carbamazepine is given. And these are actually it is what you are eating is excreted in the urine or stool, and it is coming into the water, and it is coming into the plants and all the life forms, and finally it is reaching you also. So it is each patient who is taking medication, especially for this diabetic patient, once it is, and this lifestyle disease medication, once it is started, it is lifelong. So you are polluting the earth also, and all the life forms in the gradually will be affected also.
With respect to patients who are having complications of diabetes, what and other comorbidities, how can they actually see lifestyle correction which is clinically supervised?
So the patient who are, I can tell from my experience, because clinically supervised lifestyle correction, there may be so many doctors may be doing it, but I can say from my own experience point of view, my own way of doing it. I have seen many patients, it's diabetic patients, especially who are 20 or 25 years, who are taking medication. They will be having definitely some other diseases also. And I have seen hypertension, dyslipidemia, the statin, they will be on statin, and most of them will be blood thinners, or the heart patient, cardiac problem, hypertension will be there. And along with that, they may be having varicose vein or other arthritis or some autoimmune disease or allergy. So many problems will be there. Some may be having just diabetes only, but even that person will be having obesity, or at least there will be abdominal obesity will be there. And so lifestyle disease, once they get it, for a diabetic patient, definitely they will be started within a few years, they will be having other diseases also. And if they are on medication, what in my way of doing is, first if it is diabetes patient, we'll check whether it is type 2 or type 1. If it is type 1, they managed in even type 1, and there is no more C-peptide is low, very low, then it is considered as type 1. And then also we'll try to increase those patients who are on many years on insulin. They may be having excess fat, and insulin resistance also will be there, because they will be coming for this, because poor control of diabetes. Poor control of diabetes with insulin in a type 1 patient is because of the insulin resistance also came, or they are not doing the lifestyle management in a proper way. In type 2 diabetes, if the insulin level and the C-peptide level is normal, then we stop the insulin in the first day itself, on the insulin and all the diabetic medicines itself, and put them on a low calorie, low carbohydrate diet. The sugar will be within control, the much better control within 24 hours itself than the previous one. That depends on the patient. The control, some may not be able to control the food very stringently, but some may be very able to control the food intake and do the exercise in the proper manner. It depends on the patient. And within a month, diabetic medicine is first day itself, and the other medications like hypertension, cholesterol, everything will be checking in every week. Actually, the BP and sugar we can follow up in the home itself, and the weight target also. If they are obese, the target weight reduction every week, what is expected also will be there, and it will be followed up in the with the telemedicine. Now the facilities, the social media, and so much of development is there. So the patient need not stay in the hospital or anything. Only thing they had to, it's basically this clinically supported lifestyle correction is course for how to manage. We are learning, the patient is learning how to manage their health problem with the support. So if the patient is following, within a month almost all the medications will be over. The only thing, if the psychiatric patients or the patient who are on rheumatoid arthritis or other sort of autoimmune disease, too much of medication is there, it may take some more time. Psychiatric medicine also we have to taper off very slowly, because of this addiction tendency will be there. And within 3 months, if the patient is following and they are following the instructions correctly, they will be out of medications. And all the metabolic disorders, it will be within a month itself, it will be over. The psychiatric and autoimmune disease, it may take some more time. Only exception is this patient who was put on this pacemaker and all, they will not be able to come out. They have to continue their blood thinners lifelong. All the other medications, if a patient is put on a stent, Then they had to take 1 year this blood thinner. They have to then only can after 6 months if they are taken 2 or 3. I had seen 3 blood thinners together and all. In that case, they can reduce after 6 months, but at least one is needed up to 1 year. And after that, by the time all the blood parameters have also come down, and if the patient is following that, also they can come out of it. That is the way of managing with my clinical supported lifestyle correction. This is my experience actually.
Why does medication and insulin provide only temporary blood sugar control?
So when we take the insulin has only very short action. There are different type of insulin, that is short acting, intermediate acting, long acting, ultra short acting, and different types is there. So whatever be, its maximum time of action is only 24 hours. And also the most of the medication, that also maximum time is 24. That's why we are taking every day the medicines is taken. So only that short time you will get the benefit. After that it is effective, there is no use for that. If you are taking for 10 years insulin or the diabetic medicine, if you don't take 1 or 2 days, your sugar will shoot up. That is why these medicines are not having any curative effect, only that symptomatic relief.
See, when you are talking about diabetic patients and this lifestyle correction with clinical support, what is it that the family members or the caregivers of that particular patient should be aware of? Because normally we find that this requires some sort of support.
See, for clinically supported lifestyle correction or even this lifestyle correction, first thing, the patient has to be aware of the importance of it. And that is the major problem. The patient and even the bystanders or the close relatives, even if the patient is very much aware and they want to do the lifestyle correction, and many of the times close relatives are the main obstruction. And if in the family, if there are a few doctors is also there, it is the patient is never going to achieve. That is the current situation it shows. And that is my experience actually. If when the patient is, many of the patients actually coming without telling their family doctors actually. Because if you say that you are going to correct the lifestyle and diabetes medicine will be stopped on the first stage, so they will outright they will say no, it should not be done, it should be so dangerous and so many things. But actually we are not doing, the patient or the doctor is not doing it blindly. They had to check the blood sugar. Now the facilities are available and you can check every minute. You can continuous monitoring is there, or at least 4 times you can check till the sugar is making sure that sugar is controlled. And also with the clinically supported lifestyle correction, we check initially weekly HbA1c. So you can see the result. It is not blind. You generally saying the general public has and the doctors and even the media is giving an impression that the lifestyle correction and this natural way of correcting is something sort of pseudoscience. That is what many of the places you are using it, and it is actually incorrect. The pseudoscience is actually for type 2 diabetes, taking insulin is pseudoscience or something that is totally against the principles of what we understand. Those things are started years before, which when there is no clear understanding about the diabetes. Now it is very clear that type 2 diabetes has excess insulin in the patient. And we know that many of the diabetic medicines, which is actually making it action by increasing the pancreas or pushing the pancreas to produce more insulin, that both way it is incorrect. That is, anyone with the real common sense is necessary. Only the need for understanding this, because anything, if the insulin level is high, definitely it is damaging, and also insulin level is low, it is not good for the body. That is why type 1 diabetes patients should take insulin, and type 2 diabetes patient, if you are taking insulin or the diabetic medicine and you are increasing the insulin level also to control blood sugar, you will be landing with more trouble. That is the reason after starting these medicines, the patients will be getting hypertension, dyslipidemia, heart disease, and all is because of this hyperinsulinemia and the medicines itself. And medicine also help promote the kidney, and it will push the kidney, and it will strain the kidney, and renal failure. And sugar also is damaging, insulin is damaging the vessels, and again along with that the medicines also.
Actually, when you are talking about clinically supported lifestyle correction, normally we hear that in this approach, the tests and investigations are done not only for that particular disorder or disease, but also for generally for understanding the total health of the patient and all that. So it seems that the costs of the tests are on the higher side, and also they have to be done at some intervals. Uh, what is the reason for that?
For properly doing a clinically supported lifestyle correction or even like lifestyle correction itself, you should have a very clear idea about the body situation. For example, if a diabetic patient, first thing we have to know is the condition of the kidney. If the kidney is in failure and the creatinine is high and the electrolyte imbalance is there, which is very common with the diabetic patient, in the renal failure, the potassium may start going high. Or without that, in the medium, this grade 2 or 3 patients also, the sodium is low. So we had to, sodium and potassium, the electrolytes is the most important for the minute-to-minute maintenance of the body, especially the blood pressure maintenance and all, and the heart the functions of the heart and all. So we had to, not only that, and we should know the heart, this diabetes will affect all the organs of the body, because every organ there is blood vessel. The blood vessel is the primarily affected. So that is why before starting this clinically supported lifestyle correction, we should have a very clear idea about the system and also about the immune status, hormonal status, nutritional status, and the food which is proper for the body. But also it's all available now, but it is not costly. This, especially this such tests are costly. So we should have a very clear idea, then only it can be successfully done.
With this, we come to the end of the part 4 of this 4-part series on insulin and diabetes. In this last part, we were focusing on clinically supported lifestyle correction for managing diabetes, insulin, and related comorbidities and other complications. Thank you.